Today we are going to have a very interactive session on communication, one of the major aspects of any field, especially palliative care. And we have a versatile personality joining us to walk us through this session, Dr. Radha Venkatesan. For faculty introduction, for the session facilitation, I hand over to Miss Arati. Arati, over to you.
Thank you, Sri Priya. So Dr. Radha Venkatesan, she has served as an anesthetist tutor and has gained 8 years international experience by working in Saudi Arabia and United Kingdom in anesthetist. She was a part of Cancer Institute Area, Pain and Palliative Care Services for 3 years. She also helps us with our academics team by taking sessions and also a very dear friend of Pallium India. Welcome, ma'am. Over to you.
Good evening to one and all. First, a big thank you to Pallium India and the whole team. It's been a pleasure. I've been acquainted with them for some time, and having worked in Adyar Cancer Institute, I've known them and been in touch with them for the last few years. So it's a pleasure, in fact, and it's a privilege and pleasure to be part of your team. And it's a combined teamwork. We're all trying to work to one aim and goal, to improve palliative care services all over the world and part of India too. Okay. If everything is okay, I'll just start sharing my presentation in a minute. Can you all see now?
Yes, ma'am.
Okay. Good evening to one and all. As has been told in introduction, communication in palliative care is our topic. And communication is very, very, very essential. I can put any number of veries to it. And we will know why I'm starting like this through our presentation. First, good communication is vital. Everyone knows this because in our day-to-day living, how, what, and where we convey is very important to be successful in either a small friendship or a big project. So that's what we're going into. First, what is communication? Communication is a process by which information is exchanged between individuals through a common system of symbols, signs, or behavior. So from the definition, what we see, it could be in various forms. So it could be like just through words or through signs or by gestures or no. Above all that, just the body language is enough to convey everything in a good or the other way too. So what are the types of communication? 3 common types I mentioned. First is verbal. In verbal, we have regional differences, languages, so many things. Combined group of words convey many, many things. Next comes non-verbal communication, which sometimes may overtake the others. Non-verbal communication, we very well know. Eyes convey a lot. Not even words are needed. Just by eyes, many things are done. So next is facial expression. Then comes body language. So all these, so it is not that only one method of communication is available. The third one is visual. Always it is said photographic memory. One picture can convey a lot. I'm going to take a very, very common, most interesting example for this. One poster of one movie will convey so many things. How are we getting everything? It is visual, by visual communication. So one picture can convey the whole plot. So that important, it is visual communication. Next, what is the importance of good communication? It helps us to connect with people effectively. Every word in this matters. Connect with people and effectively. Next, helps to know them, more about them, come close to them as sufficiently as needed. So there a line is also drawn. Next, helps you to make them comfortable. So as I said, no, if you are in the right place, right time, conveying the right thing, you gain their confidence. So that is what is the next thing. So by how you do it, you get a better position. And that is important in success. Ultimately, what are we all looking at? We are looking at a good, best outcome. For that, everything of this matters. Next, why is it important in that, why communication plays a big role in palliative care and the main significance of it? In palliative care, we are dealing with something which is not simple and straightforward. We have complex symptoms, complex situations, so we have to manage both. So normally we would say it is not like something like run of the mill. Day to day, all of us have some day-to-day routine. So it is not something simple and straightforward like that. So that is where the significance of good communication comes. And in that itself, a bit more in detail, they're not straightforward situations. They are difficult and different topics and situations. See, normally these type of things, life-changing decisions or life-changing situations, no one would have met with something like this all through their lifetime. So it is not something they would have imagined. Many times, many don't even think about it, even though it is essential. It is part of aging, part of everything. But unfortunately, we always take good things and remember that. That also has a positive thing. But at the same time, we have to cross the bridge when required. So that is why these are difficult, different situations which have to be considered appropriately and managed very well. It can be managed well, not to have an opinion, oh, they are difficult. I would generally say I wouldn't use a difficult. I would just use it as a different situation. So different topic. Ideally, the difficult word has to be taken off. And even in your day-to-day life, if you start replacing difficult by different, everything will become easily manageable. Next, we will dwell into what are the skills, how are we going to learn, and things like that. Communication skills. First, one important thing is among the skills, we will see many of them one by one. Non-verbal communication. First thing, smile. Smile takes you a mile. Smile is very, very important. Even if we have not, or if we don't have that skill, we can take conscious effort to develop that skill because it is going to be very, very helpful. First, helpful to the patient. Next, helpful to you also. Smile is something which we have to develop, and you will see the benefit of it as you progress in your own career and in your own life. And for that, I'm going to tell a small fact and type of thing, which generally when you smile, you use less muscles. When you frown, you use more muscles. If you generally want to keep yourself young and charming, better to smile rather than to frown. So this is just an additional thing down through our topic today. So smile is something very, very important, and it is worth developing that habit. And especially in situations where we are going to be, patient would be in a state where they would have given up on many things like that. So the smile is very infectious also. It could make them happy also. So it is worthwhile thing to cultivate and develop. Next, posture and position. That also plays. If you see this picture, what I have got on, the posture and position is important because, see, normally we say, at the level of the patient. Always try to be. Say there, why is that given so much of importance? Hierarchy will be taken away. For example, if you're at a higher level, patient is at a lower level. Generally, it's a patient may be scared. They may not come up or reveal what their actual state or thought is. So this hierarchy should be taken away. So in that way, you being at the same level is more helpful than being at a higher or a low level. Both high or low may not serve the purpose. So there comes position. And then next, posture. You have to be in line with them. Say the body language comes. So anyone and everyone can pick up through your body language itself, whether you're comfortable, whether you're nice, kind. You may not know, but you will be expressing that. So you have to give importance to both the posture and position. So ideally, see, if you see in the picture, the carer and the patient are in same line. And next important thing is eye-to-eye contact. Eye-to-eye contact makes the other person think, oh, they are considering me. So I will have confidence in revealing things. So eye contact is very, very important. Next comes personal space. Here, I would say it has a great extent of cultural, regional, and gender differences, everything. We have to give importance to everything because we should know to how far you can occupy the personal space. So ideally, you should give room because see, some may get apprehended if you go too close to them. So this personal space has a great importance. So by giving that adequate personal space, you start the conversation. In due course, you will know whether they themselves feel comfortable or what. So that will give you a clue to decide how much is the personal space you are allowed. Okay, so every point of this is essential and important. Next, active listening. This is again something, see, first few points what I'm mentioning are very, very important, and they have to be developed even if we don't have, because that is by developing that we are going to be definitely successful. So next is active listening. What is meant by active listening? Why is it mentioned as active listening? Is there some other type of listening? Yes, passive listening. You may be there physically, but you may be in some other world. For example, I'm telling you may be there, but looking at your phone. See, no one to get none to be offended. But these are things which no one will like. Even you will not like if it is done so. So we have to have all those things in mind. So that is what first point is, paying attention. So you just listen to what they are telling. And so that gives what they gain faith and establish confidence in you. And then not to interrupt. When you ask something, you should give them time to reveal and convey what they want to say, rather than stopping. Oh, I know, go on to the next. That's not the way forward. Okay. So paying attention, not interrupting them. And also, how are we going to confirm or convey that we are doing active listening? By doing a head nod, or in due course, yes, go ahead. Yes, I am understanding. Go ahead and tell me the next. Some clues like that. Clues and cues you can give so that they know that you are following them and you are paying attention to them and things. So verbal confirmation, as I said, you can say. So what does all this give? This gains rapport, confidence, and they will understand, oh, this person is considering what I'm telling, and they are listening to me. So those are things which are important, because only by that we are going to gain confidence. See, many times you will be, if you gain this rapport and confidence in the first few occasions, the whole management will be easy, because it may be some simple personal issue causing the whole problem or something like that. So just by gaining confidence, you would have been able to see, few of them might have seen the same person, but everyone would be finding it very difficult. We can't come down to the bottom of the issue. Why is this happening? just by gaining confidence. It may be something very simple, but they might not have told. But by gaining confidence and rapport, you will be able to get that out from them and be able to solve the whole issue. Next comes question time. So once we have gained confidence, next what we're going to do, we're going to ask some questions. What type of questions are you going to ask? There comes, so you don't ask, did you have a good day? Then they'll say yes, no, that's all. So how was your day? What all did you do today? So open-ended questions are preferred than closed-ended questions. Why? Because that gives them a choice or option to reveal more things. If you ask closed-ended questions, you'll get a one-word answer only. That one-word answer may not be helpful for us. And by asking open-ended questions, you're able to get true and detailed response. And next comes in these, when you're having a conversation type of thing, sometimes remaining silent also is important, because giving them, as I said in the previous way, giving them some confidence so that they themselves, they might not have told before, but they will come up and tell you. So questioning, how you question, what type, and then by giving them, because many times everyone is in a rush. So they think, oh, no, they don't have time for me. So that's not the way forward. So if you give some time and listen to them and be silent, sometimes it may help you to pick up even major issues. Next, how are we going to talk? Clarity, simple, clear language, hi-fi ended words, what the other person may not even know. So no jargons should be used, clear, simple words. And then if you convey something, for example, especially in this profession or whatever you're going to do as volunteers, you're going to help them in either dealing or helping them with their medical issue or their financial issue or whatever type of issue. See, the whole group of volunteers can be from volunteers to help in the nursing care or help them in social issues or psychological issues. So it could be in any form. So in that way, so you are expertise in something. That is why you want to share your skill and knowledge to help people. So in that, you may be able to know more. But at the same time, when you convey and when you're conveying it to them, mainly we are going to help and raise awareness. So that time, use simple, clear language. And then as you say something, stop in between and ask, have you understood so far what I've told you? If not, don't hesitate. Tell me, I can explain once again. And then next comes the tone and volume. See, we have to, if you're going to straight away go and order something, oh, no, I'm not going to do it. This is not the way it has. So these are things, no, all of us are not made alike. So we have to ultimately, again and again, what's our aim and goal? To have a better outcome. So how can I achieve it? So that's going to be our aim. So here, adequate tone and volume of the voice also is important. Next comes empathy. Empathy is something very important. Empathy is the capacity to understand what another person is experiencing from within the other person's frame of reference. Normally what we say, the capacity to place oneself in another's shoes. So see, for example, any situation if you take, they may be explaining. So you have to think, well, if it was me, or if it was me in that situation, how would I feel? Or how would I manage? So see, in this two things, how would I feel will help you understand the situation. And next, how would I manage will give you clues. You may think, oh, this is how I would do. So maybe I can tell them. So if they have not done that, they can try that and see. So that is what we are trying to convey in this. Next comes important thing, team working. See, as I said, as volunteers, you're all going to work together. How? Either among yourselves or with the medical team, with the nursing team, or another way is you're going to connect the medical team with totally another social welfare team or charity team. Somewhere you're going to be the link between. So team working is very important. We have to respect each and everyone equally. Because again comes, if it was me, what respect would I expect? So if we do that, so again, additive effect, summative effect you're going to have. So if you're going to not respect each other, so you're going to be the loser. So respecting each and everyone equally, working together. And main aim is putting the patient in the center and do everything in patient's best interest. That's why this respecting each and everyone equally, so that once you know you're all equal, for all of us, the main aim or goal, we have the aim and goal which is the same for all, and that is the patient's best interest. And always look at the broad picture also, and have in mind the social and cultural situation, because everywhere, that is where regional, social, cultural, everything is important. Each person may have some view and idea, but you have to come to the reality and see what is best and what is feasible. See, something may be best, but not at all possible. So no point going for it. So every aspect of it has to be considered. Next, as we saw before, the specific situations in palliative care. We saw that they are sensitive and emotional issues. So there may be other social, cultural elements to be considered and respected accordingly. Financial and resource-related aspects to be looked into and managed appropriately. As we go down, we will see them in a bit more detail. Spiritual thoughts and values are to be referred to. Now we are going to see how to manage this as volunteers. So we will take the various aspects of palliative care, which I've taken a few examples, so that in each one, how are we going to use these communication skills to manage? What are the common aspects that can come? Medical issues, patient care, social issues, psychological and emotional issues, financial shortfalls, cultural and spiritual issues. First, medical issues. See, communication from the medical perspective is a huge topic. Okay, that one has a big role to play. So I'm not going to touch that in more great detail, because, for example, I'll give you just few clues and cues why it is important. Because as I said, it's a sensitive issue. So we have to convey something. So common things are there, like normally we consider, we have to give the important news. So breaking bad news, then denial phase. Sometimes patient will be willing to accept. Sometimes, even though they know everything, they don't want to accept. That is just like self-protection mode. So all of us know this denial thing, not only in this palliative care. Many of us go into denial mode in our day-to-day living also. We know something, but we don't want to accept. So those type of complex issues are there. So I'm not going to go, because each one, the word like denial, breaking, everything is a topic on its own. How it has to be done, where it has to be done, who has to do it, in what presence, and how are we going to approach, how are we going to manage. Everything has a big role. So it's a huge topic on its own. But why I've taken here is, as volunteers, you can do a role there too. I'm going to give a small example. See, for example, you've got a patient who is having some major issue, but she is on her own. For example, I'm telling. So, but she's very worried, concerned. It could be a he or a she, anyone. There's no gender bias in this. So in those situations, they don't have anyone for them. But all of us would be happy if someone is along with her. So in those situations, you can, if the patient is willing, see here confidentiality is there. But if the patient is willing, they sometimes feel too much is going on. I would be happy if someone is with me, because when the doctor is going to tell me something, I don't know whether I will be able to grasp everything, whether I will remember everything. So I don't mind someone coming in with me, so that you can also listen and explain to me in more detail. So these type of situations, see, there's nothing, medicine is a field where there is no one box standard only. You will get variety. That is why this profession is interesting and challenging too. So in those situations, you can be of some help. You can be with them, listen to what is being told, and then convey it to them when they are little bit better off in mood and state. So if they are happy, you can do that role to help them. So there in medical issues also, volunteers can do a role. So this is one example I have took. So there could be other situations also where you could be helpful. Next, patient care. In patient care, see, in volunteers, some nurses can also be there, or not necessarily nurses. Any common public also, you can get trained, and there are many things like day-to-day care of patients which can be taught and learned, and we can be of great support to the patient and the family. So from patient care point of view, we can develop the communication skills, what we have meant. So we can convey some awareness information to the patient, can be empathetic, and then help them to solve issues. And so there are so many things, as we have seen. You can be a good listener. That is enough. See, many times, many situations, they are upset or worried because no one is listening to me. So everyone is busy. So any role, whatever I've said before, can be taken by a volunteer and used to help. So next is by using the acquired skills. As I said, you can render the service, and then you can teach patient and the carer some easy home nursing care solutions, which I'm going to give you a couple of examples, of which hand hygiene is of utmost importance. Hand hygiene is what? Simple hand washing. That can take us a very long way. See, why hand washing and how you do the hand washing technique is so important. Internationally, so many studies have been done to show that this is basic hand hygiene, it's called. Why? Because not necessarily just a soap water wash has been proven to be better than many other types of techniques. So, but it has to be done properly. So the first picture shows you how you should wash your hands, especially going between the fingers, nail beds, and then the thumb. As you see, all that just with soap water, but you scrub each for few seconds, and then do exactly what all is mentioned there. So scrub, soap, water, soap, scrub all areas. It will take few seconds, 10-20 seconds it will take. But that 10-20 seconds, you do all this properly is so important. That can reduce infection. So infection control, this is one of the important techniques which are taught, which are monitored and assessed. So by following this, they even see if the infection rate comes down or goes up. So these are very simple stuff. This is nothing rocket science. All of us do it, but do we do it properly? So this can be taught at home. And our next part of it, I'm going to say, by doing this, you're going to teach the patient and family very important thing. One is you're preventing the patient from getting infection. Next, the carer is very important. See, that carer is the person who has to be looked after too. By caring of a person, the carer shouldn't get infected too. So next part is where to do, how. We have first seen how to do it. Next, where all are you going to do? So whenever you're going to do some type of caring job to the person or patient, you do this hand washing before doing anything with the patient. And then do whatever you're doing. For example, toweling or giving a bed bath or something like that. So before that, you do the hand washing. Why are you doing that time? That is for the patient's benefit. So the patient is not going to get any infection from outside. So you have done everything. Next, you do hand washing again. Why are you doing that then? That is for the carer's benefit. So the carer doesn't get anything from the patient. So this is very important. And this is nothing very hi-fi, very simple stuff. So by doing that, it's a general water, soap is there everywhere. Just by teaching this hand washing technique, you're going to achieve something. So that is something, as I said, both the patient. And then next we have in that, when are the situations that you should do. As I said, whenever you're going to touch and do anything with the patient, or any body fluid of the patient, like catheter or any fluid discharge, so any body fluid, you're going to come in contact, or you're going to touch the linen or something of the patient. So all these situations, or any procedures being done. So you're going to assist someone is coming home, and see, we are doing palliative care mainly like home care. So not necessarily everyone, because from palliative care point of view, even that many studies have been done and proven that if you ask 8 out of 10 people, they'll say, I would like to be at home. I don't want to go to hospital. You and I will also say the same, because home is best. So many things are being done now at home. We have so many home care teams. So these can be taught to the patient and the carers, and for this, no one needs to have any extra qualification. So these are some things which can be learned by the volunteers and done. You can learn first and then teach them. So these are things like, these are very simple. As I said, there's no rocket science in this. But if you practice, the benefit is going to be for everyone. So these are some of the important C's in care. Compassion, being kind, competence. As I said, you have to know what to do. Communication, which we have seen. Courage, we have to be brave, not to be scared. And by being brave, you can make others also brave. Many people like fear of the unknown. Many are scared because they don't know. Once you develop the knowledge and skill, courage vanishes. Courage comes in and then the fear vanishes, sorry. Commitment, always in anything, being committed is very important. Next comes social issues. When you're going to deal with social issues, it is very important that you have a one-to-one conversation, either with the patient or with the carers, because see, many sensitive issues, personal issues, no one wants to reveal. So as I said, you should have gained rapport and support, confidence, everything. Only then you will be able to have a one-to-one conversation. And that one-to-one conversation is very important. And always, just no point having just a conversation and asking the problems. The next thing is that you have to think and come up with some solutions. Only then someone is going to be happy. Oh yes, I will listen to whatever you say, but I don't know what to do. That is not going to be helpful. So always have a nice conversation, have a one-to-one conversation, sit with them and see what can we collectively come. You can get some suggestions from them, and then we have to see if it is practically possible. Then the third point, what I mentioned is, you have to look at solutions which are achievable. See, sometimes you can think of something which is not practically possible, or it will never happen at all. So I just come as a nice passing. When you're 25, you'll be a big player or something. At 75, to be the same is not possible. So you should look at what is possible at that appropriate time or phase of life. So that is what I'm trying to convey here by achievable solution. This you can take for any issue, even a social or social issue also. If they say something, is it possible? So look at options and solutions. These are the achievable solutions. Now let us talk and see what can, of the lot, can anything be changed and made? Next, psychological and emotional issues. See, this is something little bit of a challenge. Okay. For this, again, resources available in each place matters. If you have a psychology team, psychologists, clinical psychologist, or someone with you, so then the challenge, managing the challenge becomes slightly easier, because you can have something called as a multidisciplinary team meeting, or you can refer the patient to a psychologist or counselors. So it can be either by referral, or it could be a multidisciplinary, so that one person sees all the faculties in one meeting or something like that. So these are possible if the resources are available. Okay, if not available, then what we are going to do, we are going to see, if possible, can we manage? So for that, again, by communication, you try to get all the information, and then you collect the information, come back to the institution or organization, then have an MDT and see how are we going. Are we going to use other resources, or are we going to manage with what we have? So those type of things can be considered. Here, silent attentive listening, as I said, sometimes, see, many times, no, it could be considered as a medical issue. I'm just giving an example. But for example, something, it is not getting resolved at all. But if you go in and see, it will be some psychological or emotional thing that is going on, which is aggravating. Because, for example, if you take pain, it's just not a physical symptom. It has got so many other things along with it. It's the experience that they've had, is the emotional element, sensory element. So, for example, I'm taking that because that is commonly, if you dig deep down, you will find, oh, something else is there. Or they may be having issue at home, or they may be thinking that they are a self-burden. They may be thinking, but the rest may not be thinking so. So these type of issues could be managed if you have a proper conversation with them. And only if they gain confidence in you, they will review. Next comes financial issues. Financial issues, see, again, you may be able to solve sometimes, but sometimes you may not. Again, there, what are the options that you can do? So if it is something like you can get the help of charity organizations, or you could be a bridge between the patient and organization, and try to, for example, again, what I would take is, for example, someone is not well, but they have, it's a young family, they have children studying. So they think, oh, I'm not well, I'm worried, how will I fund for my children's education? So there you can be a link, because sometimes there are so many people who want to donate or take care of children, but they don't know where and how to do it. So you could be a link between them and solve the issue. Or you could get some organizations who are willing to help into the team and see if that could help them. So normally these type of things can be organized. So you could be, as I said, a bridge, or you could be one who could organize for some meetings, because there are many organizations like that who are doing. So we can try to find out, first find out what are the issues, then can I help directly, indirectly, something like that. So those are the options that could be thought of. Next is cultural and spiritual needs. As I said, again, this is sensitive, but cultural, we have to give due respect for regional and cultural values, because that is important. That is how each person is grown all their life. Suddenly you go and say, no, you can't do this. They will not be happy. And it is not right and fair on our part also. So due respect has to be given for that. And then we have to see, according to their cultural and regional needs, how can we work together and do it. Last but not the least is spiritual needs. If and when dealt with, give great satisfaction. So from this point of view, we have to have a clear difference between religion and spirituality. Religion is a set of action of faith. They have some ways of doing it. Whereas spirituality is something beyond. What is spirituality? Religion is like a community-based, whereas spirituality is individual-based. By the word spirituality, what you do, or what are you trying to convey? We are trying to find what is the meaning of life, what is the purpose of life. So even in that, they have done some studies which have shown, like, people who have who have some spiritual belief and faith and follow something, they deal and manage with palliative care situations better than someone who doesn't have that aspect in their life. Finally, like what are the important, the 7 C's of communication? So as we have seen before, it has to be clear, it has to be correct. We are not going to give unimportant or faulty solution or suggestions. It should be complete, concrete, concise, coherent, and finally, it has to be courteous too. Okay, now how are we going to be able to acquire all these skills? By now, what are we doing? That's what it is. Training. First, you undergo training. I have achieved, you've undergone some training. So then you go into trying to practice it. If you feel fine and good, fine. If not, you can retrain. Retrain if and when required, not only once, like if you need always this continuing medical education, as we say, no, that continuing education holds good for anyone and everyone, because everything keeps on improving day to day, because that's change is permanent in life. So that is what is important. So you train and then need be retrain and train whenever required, and working together as a team is very, very important. In this, now, generally working together as a team, one important thing, there is no I in team. That is something to be taken. Like one thing you want to take from today means, I would say, the team working, there's no I in team. So that is what, if you follow that, you will be a successful team. Keeping patients' best interest as the point of focus, always. That is going to be my main aim, goal, objective, everything. That's what it is. And so with that as aim, goal, and objective, you move forward and then you will be successful. Respecting each other and also maintaining dignity to one and all. So every word of it has a big role to play. So finally, I would say, so team working is what is going to help us achieve our goal, objective, and success always. Thank you, one and all.
Thank you, ma'am.
Thank you, dear. I will.
Hope you were all able to gain the idea on how important communication is, not only in palliative care, but in normal life as such too. So now we are open for discussions. Please come forward with your queries or questions if you have any. Or you can raise your hands so that or you can use the chat box as well if you have any queries.
This is a session regarding communication, and we are lacking communication right now, I suppose. See, first ground rule we would like to share here is that there is nothing right or nothing wrong in this platform.
Thing is that there is a lot of information, okay? But you need, see, for example, you go into any area or aspect of start to do something, there is enough and more. But we have to learn little by little. Baby steps are needed for everything, okay? We cannot jump and run an Olympic or something straight away. So only by doing. So first thing is that fear and apprehension has to go away. Willingness to do, especially this volunteering, is one of the important aspect of life. See, end of the day, all of us have to pay back something. So this volunteering, I would hats off to everyone who is willing to do it. Okay, so that is what it is. So as I said, I have conveyed a lot, but you have to take everything in, and without fear, you go in, work with all these things, you will be definitely able to be successful. And the satisfaction that you will get at the end of it, no match.
Ma'am, we have a question in chat. One was how we can improve our communication. I think that's a very open-ended question.
Ma'am, you're muted.
Ma'am,
Radha, ma'am, you're muted.
I was just reading the chat box.
yeah.
Okay. The thing is that, see, basically good and bad communication. as I told you, no, like through my conversation, I said, if someone is, I'm going to give you just simple layman examples. Okay, that's what you just take. You're going to see your friend. Okay, and you go to her house and she sits watching the telly or she sits on her phone. Are you going to be happy? No, not at all. So this is something that is one basic step. Next is active listening. And then you have to give this eye contact and willingness. See, through the conversation, you are showing that you are this position, eye contact, smile. Everything is important. Body language, you go sit there and look at something else. If, okay, I'm talking to you, I'm going to stand like this and talk. This is enough. Bad communication. Okay. So like this, every element has got like verbal, how you speak, what you speak, and then your body language, all that is important. Because see, we are not dealing, okay, if they say, don't say. If you're disinterested, then you can have any communication. That's not the thing. If you want to be successful, you should have good communication skills. See, not only for practice, in your day-to-day living, but why are we telling this so much in great detail for practice? Because unnecessarily, your time, their time, everything is wasted. Time is precious. You can go do something else. Okay, next, what was the some practical example?
I have
something
a question.
was there.
Yes,
Dr. Hassan, yes, please.
Okay, thank you very much for the opportunity. Thanks, Dr. Radha, for the informative teaching. Learning a lot from the lecture. If I may ask, please, the last slide you showed, there are the diagrams. Can we please go to that slide kindly?
1 minute.
Like from here, two of us are participating, Lima and myself. So we have questions on the slide.
1 minute, 1 minute. Is it this one? Oh, 1 minute. I'll have to share. Is it this slide?
Madam, the slide with the diagram, the semicircular diagrams.
Which one slide with?
I think the C is.
Okay. I got it now.
I mean, it would be slide number 25, ma'am, if our
Okay.
guess is correct. 7 C's of communication. Is that correct, Dr. Hassan?
Is it this one? 1 minute, 1 minute.
Yes, this is the one.
Okay.
Okay.
Go ahead.
My question is that these 7 C's of communication, correct, complete, concrete, concise, coherent, ma'am, you can please kindly repeat the examples, then it will be easy for us to understand kindly with those words.
You want me to explain each one, is that right?
Yeah, just to in short, which one is how we can do it in the practical level, like with the patient.
Okay, no problem. Okay, correct is, see, first is correct, you convey the correct thing. For example, you're going to say, what is the diagnosis? Okay. Or something like, for example, you're explaining about no need to go to diagnose, simple infection. They are having some infection. You're going seeing, if it is for the patient, any example, if I give, it's okay. Is that right?
Yes, madam. Any example concerning the patient's problems,
so,
like,
okay,
like
that's
wound
all.
of the back or pain or anything.
Okay, no problem. That's all. So something. See, correct information means. So, for example, you're going with a nurse or someone, or they are going to convey the patient has got some infection. So you have to say what it is, how we found out. rather than telling no, we this is the infection they've got. This is how we have got some test results, and this is the medication which is being prescribed. So that's what you're going to say. How to convey? So how I said that would be the better way. The incorrect way would be you just go. I go there. I was told to tell you, but I don't know what infection it is. And you give a instruction, and that too you say, take these tablets. How to take? Oh, I don't know. How many days should I take? So that is correct and incorrect communication. Okay. And complete is you have to convey everything. No bits and pieces. You say few things, you forget few things. So that is not proper. So anything you're going to convey, it has to be complete. So for example, you're going to say, you're being asked to come for a review. So you have to come on this date, this time, at that place. Instead of that, you say, your review is on 15th July. You don't say where they have to come, when, what time, whom they are meeting. So that is incomplete. Concrete means what? It has to be concise and definite. That is what it is. And next is concise means what? You don't tell unnecessary things. For example, concise is to the point. What is concise is being too confining yourself to the point, not beating around the bush. You tell some other things. What is, for example, we'll take to see the come for review itself. Instead of telling where to come, you just say in that place there is a big temple. All that is not required. You just have to convey what is the point to be conveyed. Coherent and concise are somewhat similar. So see, these are all main things is that how are all these you use. These are various aspects of the communication. Coherent is coherent and concrete, somewhat to the point. You have to be. You have to connect. For example, if you're seeing a patient, you don't go talk about politics there. So that is not coherent to your situation. Then being courteous. See, you have to respect everyone. So there comes hierarchy. Because I'm a boss, I will say, I will order you. No one is a slave. Okay. I've got 10 options. I can take something else and go. So that is what courteous. Being polite. That is what is courteous. Clear is you have to be clear. As I said, no, you have to use simple English. Your way you speak, your volume, tone, everything has to be clear. You swallow half words, you don't speak properly. Those type of things are not correct. So those are the things which you have to have in mind.
Thank you very much, madam, for the explanation.
No problem.
Okay, next question we have is, if a patient receives a terminal diagnosis, how to break the news to him or her?
See, that breaking bad news is a topic on its own. Okay, there is something called as Spike's protocol. So that's what, as I said, no, I will just give you a gist of it because it's a big topic on its own. I will just update you 1 minute.
And I believe that, sorry to interfere, but I believe that this platform, especially for the volunteers, Breaking Bad News is completely connected with the professionals, the multidisciplinary team.
Correct.
Who handles the beneficiaries. So I believe that, I believe Dr. Sachin, who had raised the question, is a doctor by profession. Sir, in that case, we would request you to kindly get in touch with us over mail or some other mode in a private platform so that we can assist you further, because this being a platform of volunteers, I believe no, it's not the right platform for that question. Sorry.
Thank you very much. Exactly. That is why I just see, because we have to give respect for everything. That is very, very confidential. Okay. So that is why I just touched upon it. And it is, as I said, no, this communication is a massive topic. I can talk for 2 hours on it.
Sorry, excuse me, the faculty. Can I just one comment, please, on these questions of?
Yes, Dr. Hassan, please.
Thank you, Madam. Yeah. Okay, so the logic of these spikes not to be discussed here. I want to add something what you have just explained nicely. Thank you. For spikes or the class, volunteers cannot have a setup specifically like the clinicians have. So it will not be appropriate for a volunteer to maintain those protocols. Volunteers should be much more open places to provide palliative care for the patients and the relatives. Thank you very much.
Of course, volunteers do form the vital part of a multidisciplinary team, wherein many times when the clinical persons or the medical persons fail to get or they are like they are unable to fetch any clues from the beneficiaries. Many times there are stories that the volunteers had gone, they had communicated, they had made the beneficiaries communicate openly, so that the entire disciplinary team could take appropriate steps to ensure the comfort care of the patients. So it is with respect to that talent. Of course, breaking the bad news, I think it is better we give it to the practiced professionals. Moving on to the next question. Aarti.
There's no I in team. I'm just going to say one thing. So volunteers play a big role. Okay.
Yes, definitely.
We are all
Vital
team
role.
working. See, I have maybe my schooling and things. I have done volunteering work from my age of 10. Okay. And when I was working in Adyar Cancer Institute, I did volunteer with the Ramakrishna Mutt also. So I used to do a village visit once a month, I leave home at 6 and come back at 6. So, okay, volunteering, there's no match. And that's why, like from not only this time, all my life, I volunteered with Sai Samiti and done 100 rural camps. I worked in India for 10 years. I worked abroad for 20 years. So, and God's grace, I had the opportunity to go back and work in India from 2017 to 2020. So volunteers are backbones.
Yes, true.
Okay, so that's why. So I'm always a link between everything. So I respect them. I bow down to them. Okay, but at the same time, we all work as a team. So there's no I in team. That's what, as I said. So if you take home today that there's no I in team, I'm happy. Nothing more is needed. Everything else, you can see the slides and get it.
Okay, so moving on to the next question. Suppose patient avoid eye contact, then what can we do?
Yes. See, nothing is easy, simple. Okay. They will. That is where they have not come out of their shell. So in all what I've said, no, like see, we whatever, wherever we are. For example, I'll take 10th standard. Do we get to 10th standard day 1? LKG, UKG, first, second, third, fourth, 12 years. So first sitting, it may not happen. Okay. That is why 2, 3, that one important thing in any type of patient, especially in palliative care, you will take 2, 3 sittings. First time when they see, they won't even look at you because they are so down in themselves. That's where your empathy comes. First, you have to talk to them. First, you say, I can understand your situation. You don't worry. I'm not going to force you anything today. Today, we are going to just see. Okay, you know me, I know you. Okay, today, if you want to say something, say. Otherwise, don't worry. Go home, chew about it. Then come back to me. And then also, you tell me what you can. You have 2, 3 sittings. So sometimes what will happen, if by the time you speak like this, they won't even go home. I see, God's grace, I'm just telling what I have experienced. I will be seeing patients, 20, 30 patients. So they wouldn't have gone home. They'll be sitting there. What? No, I want to talk to her after. So I used to keep one set. After I finish clinic, I'll have whoever wants to sit and talk to me leisurely, come back. So they won't even go home. I'll be thinking they're going to go and come back. No, that day they'll come back again.
Yeah.
So 2, 3, minimum 2, 3. That is what it is gaining rapport. So don't worry. First sitting, first appointment, everything is not going to happen. And you also need not worry, oh, I have not learned communication. No, no, no. You have learned all the skills. The patient has to reveal patience. That's all. Active listening. So 2, 3 times it will take. And then, as I said, as we have had in this conversation, third time, you won't even open your mouth. You just go sit there. They will tell you everything. Job done. That's all. So don't worry. It is something which is acquired. And it's just not you. They have to come out of their shell.
Basically, it is, I believe, it is about providing the confidence that you can speak out to me. That is the one of the basic things I think we need to provide them first. Once they feel confident, once they are comfortable with us, they will definitely open up. As it is with all the relationships in life.
Exactly. See, this communication, this topic is many things like that. See, life, for that matter, any profession, meeting with people, this is what like lifetime experience. Always there is something, I'm going to say a little like a proverb, something is there. Anything that you learn has 4 elements. You can take it as like a knowledge, like going to school and studying. You can put this perspective to anything. Only 25% you get in school. That is it, taught to you by teacher. Next 25% by doing like combined studies is some example. You work together, 1 brain, 2 brain, 5 brain. Third one, you go to the library and study. Fourth one, practical experience, life experience. So you get the 100%. 4 25s make 100. So each one you'll get 25 only. So like that. So by thing you by this communication skill, your training, you get 25%. Become a volunteer. Go start volunteering and practical experience. There you'll meet some more people. So I know this, you know that. So there that combined work comes. Then you will go and see, oh, I'm going to a little bit do some reading on it. And then you go work in, come and work in Pallium, come and work somewhere else. Okay. So there I met 10 patients, 10 different things. And so what I've said, you have learned. That's it. So end of the day, in 2 years, you're 100%. Yeah. So you don't need 20 years sometimes. You do more work, more experience. That is one of the things. You see more patients, you will gain confidence, you will gain knowledge. Everything comes as a package.
Okay, so moving on to the next one. How approach and address biases the patient might have towards provider of palliative care. For example, regional, religious, cultural differences, especially if they don't want to engage with you. Yeah.
See, like, let me get the question right. Some really, like some cultural and regional issues they have. How are we going to deal with it? Is that right?
Yeah.
Yes.
Okay. For that, you have few options. See, sometimes you may know the regional things. Sometimes you may not know. So if you are aware of the regional things, first, and you have gained confidence, you can have a one-to-one confidential meeting. So always in these type of things, you first see one aspect. And as I said, then we will come down to what are the issues there. 5 issues I've got. So can I solve all the 5 issues by myself, or am I going to get some help? So some issues, like for example, as I say, if you know the region, then well and good. Because see, everything, just eating habit. Rice, I'm going to give very basic examples. You take rice in Tamil Nadu, rice in Trivandrum. Do we use the same rice? No. We use white rice, you use it. See, God's grace, dear, I have worked and I have lived in Trivandrum. I've done my 10th standard in Trivandrum. So fortunately, I'm telling. So for example, that rice is something very simple. But it is so. So if you know the regional things, well and good. If not, get the help of someone who knows it. You don't go dig your well down and get sunk there. So that is where you should know. If they're not revealing, see, nothing wrong, isn't it? If it were you, will you be open and tell everything? I wouldn't. So that's what, if you know and you can manage the regional issues, well and good. If not, always these are done. Get the help of the local, some cultural differences they have, or sometimes no, they may have what they feel. All this can be revealed, can be reduced by gaining confidence. First part. If not, get the help of local organizations, or what is the issue, and then we will work on it and find out how are we going to tackle it. So get the help of others. See, there are so many things in the world. What is not available now? Our Google will give you everything. Okay, but at the same time, Google is not the ultimatum. Okay, have that in mind. The brain, the human brain cannot be matched to anyone. The analytical, yes, data analytics, recurrence, everything it picks up. Personal, emotional, that and all still, that might come. Yes, everything AI is poking into everything. It will, we will be successful. Science and advantages have to be used. To what? To the human benefit. So we will use, okay, these are the issues. Can I manage? No. Can I get help from the local areas? So I will find out what are things available. So then that is all. So it's a collective team effort only. So then with those solutions, you go to the patient. Always go back, review. So these 5 issues we had. Okay, I will come to you with whatever solutions I can. I go back with 3 solutions. Oh, if the patient is going to be happy with the 3 solutions, the next 2 solutions, they themselves will say, oh, I'm okay with this. I don't need to go to that. Or if they are not happy. See, because we cannot have always straightforward solutions all the time. So, okay, I take back 3, only 1 I will accept from you. The other 2 I'm not going to accept. Okay, fine. First, let us take the one that you're accepting and move on that. And then I will work on it, whatever can be done. So then they themselves know, will say, oh, if many times no, if it is something not possible, but always everyone thinks worth a try, but they will come round to. So, but we also have to put the earnest effort. So, but we have to give respect to regional and cultural things, because that is what someone is used to, and they themselves will give, and we have help in many, many ways. Okay, having worked in there and all, no, there you have local teams who come many times and say, these are the things available. So only for that, no, we should have like some charity organizations, women group, all those teams come to these organizations, and then they say these are the things, and then you can also provide some monthly or once in 3 months meetings with some organizations like that. Like they have a group called Mind, something, many things are there nowadays. So whose help we can take. And then, or sometimes you need not, you can direct them. They themselves will also ask, because they may not be happy to reveal. They themselves will go find. So all options are there. If there is anything else in the chat box, please see, dear.
Yes, yes, ma'am. Next question is, if the patient is in a state of depression, how can we establish a good rapport?
Pardon me, can you repeat, dear?
If the patient is in a state of depression, how can we establish a rapport with them?
Okay, from that point of view, first we have to find out what is the cause for the depression. Okay, so there you can even medically treat. So if there is some cause, then you get the medical team first.
Yeah.
Because see, if they are really depressed, they may not be eating everything. When they are so badly depressed, physical health itself won't be good. So we have to deal with that first. Or maybe the whole thing is only something which is not, they're not revealing to anyone. So either a psychologist or a psychiatrist, some help. So family history, then personal history, everything has to be obtained to find out what is the root cause. So once we know what is the cause, and then we go ahead and manage with it. So when they are in that depressed state, they won't reveal. So we have to treat that and get them to some state and then take it forward. Or if it is just their main issue, what is causing, in that case, we have to explain the reality and tell them all is not doom and gloom. Why are we having palliative care? To help you only. So tell them, oh, no, don't think that everything is done and dusted, nothing is going to happen or nothing is going to be helpful. No, there are so many options. Don't think that's the end of the road. You give few choices and suggestions. So both ways I'm telling, if it is proper depression, treat it. If not, no, these are the other issues. Then sit and explain to them. See, one thing, this whole palliative care or whatever it is, we have to know that we have got plenty of patients to be seen, everything. But tender, loving care is essential, for which time is essential. And that's why we are all there to do that. See, just like running race, rat race type of thing won't serve the purpose in this, okay? And we are all willing to do that. So, okay, we'll see one set, we'll see patients as such, and then next, you will have teamwork, group work, do that, solve each things. So there are, don't think this is all very difficult. There are some simple questionnaires. You give the questionnaire to the patient, ask them to fill. With that, we can find out so many things. There are so many scores to find how depressed they are. So there are many things. Just by giving them one questionnaire to fill them for 10, 15 minutes, we can get so much information. So either way can be done.
Just adding one thing to that, of course, I am not a medical professional or something, but always remember that communication is always a two-way process. And if the person in front of you is depressed, the communication is not going to be clear for either of us. So just remember that, maybe that will help you to take the initial steps of identifying, as ma'am said, identifying the root cause for the depression and then solving it and then going back to the routine communication.
Moving on to the next question. What if the patient feels comfortable to hold your hand? Is that okay? Sometimes they get connected by touch.
Definitely. See, that's what, if, as I said, the first thing when I said that personal space, if they are happy, you can hold, just sitting next to them, getting them closer to you. That's what, again, their regional thing only. Some people don't fight. Some people feel offended. If not, touching them, holding them, that is the best way of comfort you can give. So we should also be ready for that. See, that's what this profession, and not this profession as such, and then volunteering, as I say, this is one of selfless service, which this is something which will stay with you for long. You would have done so many things in your life. You would have seen 100 movies and then done one charity event. The charity event will stay on in your mind. 100 movies, 2 movies might stay. So why this charity event stays? That is because it is selfless. We are all very good within. We are good outside also. But that will reveal by itself. So there's no match for it. And you will. But doing those more, it's a way of expression. If you touch them or hold on to them, I feel. So there's, instead of having 5 appointments to reveal, in 2 appointments, you'll get all the information.
Yeah.
Because many people feel, oh, this hierarchy is always there, dear. I don't know, even though we don't feel like that comes automatically sometimes. So we have to gain confidence from them. And then once they gain that, it will be very good.
Yeah. Dr. Hassan, you have raised your hand.
Thank you very much, Madam Priya. Yes. I have, if I can ask me, Dr. Radha, Madam, in COVID era, usage of mask Do you think it has interrupted effective communication for the volunteers?
See, but always we have to take everything with a nice aspect. But see, COVID, plus and minuses of COVID are always there. That is going to be there. See, but as long as you're going to have a good gesture and things, it will, I wouldn't say 100% it has not affected or anything like that. But you have to see life or this. You just risk, there is something called as risk-benefit ratio. So that is what comes there. This risk-benefit ratio. Is the risk more or the benefit more? So that is how you see. In one situation, if the risk is going to be more, you have to protect. See, if you see, take the mask itself. Why are we doing it? Again, for patients' best interest. I don't want, especially palliative care, if you're going to see our patients who are most vulnerable, high risk, immunocompromised. So it is always, I'm just telling an example. So here again, I'm putting patients' best interest. I'm not putting my interest there. So this is going to go away. Now already it's only a viral infection. To that stage only we have come to. Something COVID-19, something 23 can come. Who knows?
Thanks a lot for this.
Nothing to worry. Always take the positive element of it. Even if there is some hindrance, how am I going to overcome that? I will overcome that by better body language or better compassion. That is how we have to see.
You have to speak through your eyes, I think.
Exactly. See, how did I start off itself? No need of many, like parents. If you are parents, how do you get job done from your children? Only eyes can speak. So eyes can speak more than words. No, love, affection, everything is done through eyes. Like ordering also is done through the eyes only. What can the eyes not do?
Yeah, true.
Exactly. We have so many skills and which we don't use. Maybe we can start using.
Yes. So, okay, moving on to the next. Okay, what makes communication palliative care for children different than the communication for adults? So,
children as such is a challenge by itself. If they are under 5, it will become a more of a thing because they won't be able to express. Again, that is something which will be dealt in great detail by the pediatric team, but I will just give you. Under 5 means you have to have the parents always with them. You won't get any rapport with it because the child will be so scared. You're a stranger. So even that child will be on the parents' lap only. Only then you will be able to even get something. Above 5 or 7 or something like that, till about 12, 13. Nowadays, children are so smart. I have seen between 5 and 12. I've started morphine, all that with them. They are so good. So they utilize it. So everything, it is a big aspect on its own. Under 5 will be a different group. 5 plus to 12 will be a different group. So it will be entirely different. And everything, how you say, what you say, because they may not, their facial expression only, or sometimes they may not be able to express anything. Their habits and behavior is what we may have to see. Many times they won't reveal or tell anything, but they may not eat, they may not do anything normally. So with other things, other aspects of their day-to-day living is what we will find out things. So it's a big topic on its own itself.
Yeah.
And it's again confidential and things we have to take.
Many times we have to be very careful about the topics we chose to open the conversation with children as such. Like we can't just go and ask them, what did you cook for the lunch today? We can never expect to open a conversation with a child like that. Maybe we can start by asking, did you watch any movie today, or did you watch any TV show today? Maybe like that. So it is entirely different. Yes, as continuation of that, I think Mr. Dinesh has been asking, is palliative care available for children? I believe yes. Mr. Dinesh, in case you have any specific case, we would request you to please get in touch with us either through our telehealth department or our state facilitation team so that we can assist you further.
Okay. Next question
Every
is.
place has got, many centers have got
Yeah.
for pediatrics separately. They will have the general team and the pediatric team also. Pediatric team will have 1 or 2 pediatric oncologists fully, but only thing is that that team may not be there everywhere. So as they have mentioned to you, you have to see where it is available and approach them appropriately.
For that matter, we do have a pediatric palliative care clinic at SAT Hospital, Trivandrum. So, and we are starting an OP here at Pallium India on Saturdays. So if there is any specific case, you can get in touch with us through Sri Priya. So we'll be open for that. Next question is, what happens if you don't make a breakthrough in communication? Does one go on trying? Will this upset the patient and the caregiver?
If you don't make a breakthrough,
and if we go on trying and trying, does that upset the?
See, that's what say. If you don't make a breakthrough, then see, always you have to look at 1 or 2 or 3 sittings you have. Then we have to, as I said, root cause. What is that I'm not doing right? Always go back. You move 1 step forward, you then keep like you climb stairs. You go to 3rd step from 2nd. So if you are not progressing, then go back, retrace and see what is that I'm not doing right. Okay. And then maybe sometimes they may not have come. You can get another person to come in. As I said, we have to see what is that, why is that we are not achieving? What is that I can do differently to achieve that? And be open. As I said, sometimes, okay, they don't feel comfortable talking to me. Okay, can I get somebody else to see you? Or will you be able to reveal to someone else? Nothing wrong. Where, again, T, there's no I in team. I want the patient to be happy. So I will do anything for that. No forcing anyone.
Yeah.
We will never be successful. And it will not be nice to. Okay, so many times we have seen we have to be courteous, nice, and then no barging on anyone.
Yes, I even remember one quote which I believe some faculty had showed in one of our previous presentations. When the I in illness is replaced by we, it becomes wellness. Always remember that.
See, that's what. See, this I in team also. That's how I got. So I've got that. That's so important.
Okay. Next is, can we make use of music as a means of communication, as a way of non-verbal communication for patients who can't communicate?
Oh, music. We had a program in Chennai where music for therapy was also used. Music communication, music therapy. Music is something, is a mode non-verbal. Everyone understands, everyone enjoys, and everyone dances to its tune. Do you need to know a song to dance? Just the beat makes you do it. So yes, anything and everything, all these will come under non-verbal communication.
Okay. Next question is, what sort of volunteering work can children be involved in with regards to palliative care?
See, I would say 2 young children, you may be having, I'll just give an idea. 2 young means may not know, but see, they can organize like fundraising. Children, yes. First thing you can use them is for fundraising. You can tell them the importance of how they can help. These are things, habits which could be inculcated when they are small. So fundraising is something they can do to start off when they are young. After that, little by little, once they know what and how, where they are, they can come and help in the centers. To just, for example, outpatient, they can give, yes. Put a register, give tickets or whatever it is.
Yeah,
many aspects.
We do have students like that here volunteering with us. So the students who are doing their graduation, we do have a program for them like Students Initiative and Palliative Care. So we are building up student volunteers through those programs, wherein they help us in like billing the sales bill and all in the pharmacy. Coming us with us for volunteering in medical camps. Such activities which anybody can do. It's not like age is not a matter as such for that, but not into the full-fledged volunteering might not be possible because they do have sessions and all, they have their classes to attend and all. So the small time that they can, a little time they can offer us, small activities they can get involved in, like fundraising, like sending us a word of mouth in their institute or in their areas, finding out patients. With the little knowledge that they have in palliative care, they do refer patients in palliative care in their locality. So such small things they can do.
From secondary schooling, they have to start doing this.
Yes.
Secondary schooling, because see, I'm just telling what I've done. Okay, it's only a blessing of God. I'm not blowing my own trumpet. Be very, very clear with that. Okay, I'm so grateful to God, which has brought me to what I am today. Because I started all this when I was 10-year-old. But little things. I didn't do big things that time. Like age, like what, like you have HelpAge India. I have done fundraising when I was in my year 5. So you can do, I used to get 2 rupees. Okay, nothing more. I used to go door to door and get 2 rupees. 1975. So nothing wrong. So, but this has to develop from secondary schooling, or like somewhere after your 6th standard or something. And so that at what stage, what you can do. See, they need not bring mountains down. Even what they, as she said, it can be done from secondary schooling, and then part of their curriculum. This also has to become like that. So then they will carry on like that all along. So when they are 25 and 35-year-olds, they'll do wonders.
Now the last question: if the patients does not want to talk much about their problem, how volunteers can open their discussion? So it's through continuous.
Which we saw before, no, gaining their rapport, giving some time. If not, getting what other option. Mostly, once they gain rapport, they will relieve, because they don't want to be struggling. They want to find a way out. Do they want, why? Basically, they are in trouble. They want someone to help them to get out of it. So only gaining confidence, 2-3 times it might take, and then they will be able to. So either you try or you get somebody else to do. Give them the choice. Don't force them. Tell them, don't worry, you want something else, or how you want to take your time and reveal. You want one-to-one maybe, or you don't like this situation. Give them few choices, and then they will come around, because they want someone to help them.
We have one more question, ma'am. What's the role of a community nurse in developing palliative care services?
That's a big. No, they can be part of the team by themselves, or they can join the palliative care.
So,
home care. That is where we are all heading to home care.
We do have a session on home-based care, I think next to next session. So we can have that topic discussed in that session. We'll have a nurse for that. So we'll come back with the answer in that session. So that
Even though our questions had ended, the chat is overflowing with feedbacks for your session, ma'am. Excellent session, and
okay,
so many positive feedbacks.
Once she started reading questions for me, I thought, because every time I was going back and forth, I just didn't see. Oh, it's a two-way thing, dear. Because as I said, I would love everyone to come in, enjoy doing it. You will also be happy doing it. And because palliative care, one thing what I feel, it's a global thing. It's not India alone. Internationally, palliative care services are very, very less. It is one of the essential things to be done. So That's why we are all encouraging people to do. And some time of your life, you do give short time, not necessarily through your life you can do. And everyone is going to get benefited. And at the end of the day, you're going to be happy. So that's what. It's a two-way thing. I too enjoy and relish doing it. So as long as everyone is happy, they take something from it. It's a day-to-day experience also. Personal experience, personal satisfaction. By what all this, you use all these skills to make a better world, a better person too.
True, ma'am. Thank you so much for your time. It was a wonderful session. Everybody in the session enjoyed. I could see that in the chat box, and some might some are sending love also.
Oh, so nice. Big thank you to all that.
Thank you so much, and thank you everybody for joining in. Over to Shri Priya.
Thank you, Radha. Well, of course, as a person who has been interacting with you recently for a lot of cohorts, I knew that this would turn out like this only. So thank you so much for that. We do know the time zone differences, but still you found out time. You were very patient enough to answer our queries. And thank you so much. Of course, the positive feedbacks will be shared to you over email if you require, because
yes.
participants
give
will
my
be sharing
email.
their feedback in the feedback form provided as well. We'll be waiting for that. And thank everyone for making this session interactive, because it is, as we said, it has to be a two-way, since it is a communication session.
This
And
communication we have seen, and big thanks to God and all of you. Wish you all good luck. You get into this and encourage many people more, because we need more people to come in. Okay, so you all try to do, and then as I say, all thanks to God, and good luck and good wishes to all of you. Thank you once again to Palim India too.
Thank you. So with that positive note, this is Sri Priya along with Dr. Radha Venkatesan and Ms. Sarthi Venukumar signing off from the Tips Eco Hub. See you tomorrow again with another interesting topic and another versatile personality. Till then, everyone, take care. Bye-bye.